questions. What is a brace? A brace is an externally applied device fabricated from rigid or semi-rigid materials. It is prescribed by physicians for treating diseases or injuries which affect the functioning of muscles and joints. What are the goals of bracing? The goals of bracing are to help regain function of an injured part of the body, to retard the progression of a deformity, and to reduce or alleviate pain. How does bracing accomplish these goals? Braces function by supporting a weak or deformed area of the body. By aligning a weak or deformed area of the body, and by restricting or assisting motion in an injured joint of the body. What are some examples of commonly prescribed braces that may be familiar to you? A cervical collar is a brace that a physician may prescribe for a patient in order to restrict unwanted neck movement. A physician may prescribe a back brace for a patient in order to provide lower back support. A leg brace may be prescribed to restrict or assist motion at the knee. A hip brace may be prescribed in order to align a dislocated hip. Is there a difference in the protocol of bracing ambulatory versus non-ambulatory patients? The principles of bracing are the same. However, the protocol must take into account the differences in 1. The patient's basis of support, and 2. The patient's level of compliance. Let's define bases of support. Patients with the potential to ambulate may require an ankle, a knee, or a hip brace, or a combination of these braces in order to stand and walk. For these ambulatory patients, their feet are their base of support. The base of support of patients without the ability to stand and walk is the pelvis, as well as both upper and lower extremities. These patients may require braces to support the pelvis, the spine, and the upper and lower extremities. These braces help maintain body control, assist locomotion, and/or perform other ADL activities. Returning to the second half of the answer, that is, taking into account the patient's level of compliance, we present the following comparison. In order for braces to be effective for ambulatory patients, they must be secured to the body using straps and buckles. However, bracing non-ambulatory patients in nursing facilities made the use of straps and buckles a compliance issue because of federal government regulations prohibiting the use of any device that could constitute a restraint. Also, the need for multiple braces for these patients made it difficult and time-consuming for staff to put braces with buckles and straps on and off each patient. Utilizing new technologies and materials, our bracing protocol eliminates the need for strapping and buckling the braces to the patient's body.